welcome everyone to tonight's call. I'm very excited to cover a topic that is near and dear to my heart, and that's always autoimmune disease. As you know, much of my practice is focused on people with autoimmune disease. I've written an international best-selling book called The Autoimmune Answer, and currently COVID has dominated the headlines for going on, 9 months now. So this week, cutting edge research has been published about how COVID increases autoimmune risk. And I want to cover this today because many of the people on the call already have autoimmune disease. And if they were to contract COVID and have a severe course, then that could exacerbate their autoimmunity, expand the amount of tissues that they have autoimmune disease against. And for people who don't have autoimmune disease, the research is showing that contracting COVID and having a severe case increases autoimmune risk. And that's what I want to dive into today. So fun stuff. The first study here is entitled Clinically Identifiable Autoreactivity is Common in Severe SARS-CoV-2 Infection. Remember, SARS-CoV-2 is the virus. COVID is the diagnosis, right? HIV is the virus, AIDS is the diagnosis. So we for ease of communication, the media and everyone says, oh, they have COVID. But what they actually have is a SARS-CoV-2 infection that manifests as COVID if you're having symptoms. So anyways, this study is looking at, the title says it all. There's clinically identifiable autoreactivity commonly found in severe COVID infection. What does that mean? Severe SARS-CoV-2 infection is linked to presence of autoantibodies against multiple targets. We recently identified activation of an autoimmune-prone B-cell response pathway as a correlate of severe COVID-19, raising the possibility of de novo or new autoreactive antibody production during the antiviral response. Here we identify autoreactive antibodies as a common feature of severe COVID and identify biomarkers of tolerance breaks that may indicate subsets of patients that may benefit from immune modulation. So that's a mouthful, but essentially what it says in English is that people who contract COVID and have a severe case have an increased risk of developing autoreactive antibodies. Autoreactive is a fancy term for antibodies that recognize your self tissue as the enemy and attack it. And when that happens, that's autoimmune disease, because we shouldn't be attacking ourselves, right? And so the severity of the COVID response leads to overproduction of antibodies, and we start to attack ourselves. The reason that this study is important, beside that, is that these authors found that there are two markers that indicate when this is happening for us. They have high reliability there. And those two markers are called ANA, or anti-nuclear antibody screen, and rheumatoid factor. So in the research, in the study, they looked retrospectively at 52 patients that went through severe COVID, and they found that 59% of them had ANA and or rheumatoid factor positivity after the severe infection, which represented evidence of new autoimmunity in those cases. And so if we know someone that contracts COVID and has a severe case and they recover, but they have new symptoms that weren't there pre-COVID, and they're not necessarily COVID symptoms anymore, they're more autoimmune type symptoms, to screen for whether the COVID drove the autoimmunity, we could run ANA and or rheumatoid factor. And if one or both are positive, the probability is that the COVID drove an autoimmune process in them. And then it's up to us to do the detective work to follow that further. Now, the same authors of this study also published this study called Extrafollicular B-cell responses correlate with neutralizing antibodies and morbidity in COVID-19. And this is in Nature Immunology. Nature is one of the highest rated scientific journals in the world. So this is big time publication here. And essentially, two highlights I want to pull out of here are critically ill patients displayed hallmarks of extrafollicular B cell activation and shared B cell repertoire features previously described in autoimmune settings. These findings strongly suggest a pathogenic role for immune activation in subsets of patients with COVID. What does that mean? What's an extrafollicular B cell? Well, like I said, B cells are cells that ultimately produce antibodies. And typically, B cells mature in the, or are activated in the lymphoid tissue, so like lymph nodes, the spleen, etc. Those are follicular B cells. So when they mature or are activated in the lymphoid tissue, there's checks and balances that prevent them from becoming pathogenic and autoreactive and driving autoimmune disease. It's much less likely to happen when they are activated in the lymphoid tissue. But an extrafollicular B cell is a cell that's activated outside of the follicles or outside of the follicular tissue. And these cells, once you're outside the follicular tissue, there are far fewer checks and balances. So increased probability that those B cells become pathogenic, autoreactive, and promote autoimmune disease. And so the mechanism by which that happens is the cytokine storm or the severe case, like we've talked about on previous meetings. Remember that the cytokine storm is what drives severity of COVID. It's what drives the acute respiratory distress syndrome. It's what drives people to be on the respirator and oftentimes drives death. And you might remember this graphic, which showed, the cytokine storm damaging the lungs. And we talked about the cytokines, the inflammatory molecules, are what causes the damage. And one of them is interleukin-6, one of them's interleukin-8, one of them's COX-2, one of them's interleukin-1 beta and TNF-alpha. And so this study up here showed that the higher the C-reactive protein in the severe cases, the higher the risk of autoimmunity. Well, C-reactive protein is a surrogate marker for interleukin-6. So the higher the C-reactive protein or the higher the interleukin-6, the higher the risk of B cells maturing in an extrafollicular way and becoming autoreactive and driving autoimmunity. So we don't want that. Obviously, no one wants autoimmunity. No one wants COVID. And if someone gets COVID, they don't want the double whammy of severe COVID and then severe COVID-driven autoimmunity. So how might we prevent that? Well, obviously, the things we've talked about many, many times, strategies that we can use to promote optimal immunity, promote optimal antiviral defenses, lifestyle, nutrition, supplementation, physical activity, sleep, toxin avoidance, all of these things. But you might remember the cytokine storm article was looking at cytokine storm in the aged and how do we prevent that. And this article was specifically focused on vitamins as a preventive strategy. And if you look at the bottom of the page here in yellow, the authors said that vitamins A, D, E, and C promote a normal antiviral immune response and help prevent severity of COVID. How do they do that? Well, they block the production of these cytokines, inflammatory cytokines, right? So you can see vitamin D, E, A, blocking it, blocking it, blocking it, blocking it. So even though early in the pandemic, when the CDC and many media outlets were saying, hey, nutrition's useless, vitamin C is useless, there's no research, et cetera, zinc's useless. Well, all of that was the actual false information, regardless of what Facebook fact checkers said. The true information is what's in the science, and the science, long before COVID hit the scene, said that these vitamins and many others are very useful as antiviral strategies. So not only can we prevent COVID with them, we can prevent severe COVID with them, and by so doing, we're preventing autoimmunity that's induced by severe COVID. So I think this is really exciting because, again, it reinforces that we don't have to feel helpless. We don't have to be hanging on every word of the media when they say, oh, the vaccine's coming, the vaccine's coming. The vaccine isn't going to be a silver bullet and isn't even necessary because 99.4% of people survive. So, Pfizer announced today that their vaccine supposedly shows 90% efficacy. Well, if 99.4% of people are surviving, why is a vaccine necessary at all? Especially if common vitamins and nutrition and lifestyle changes can prevent us from ever getting it. So arm yourself with this information, share with your family and friends, and help them understand that their daily choices are what's really going to determine their health or their disease. And they don't have to be dependent on a pharmaceutical company or the mainstream media for health.